Welcome, ladies and gentlemen. Thank you so much for your support in this channel. I don't take it for granted. Now, it seems to be tough for William Ruto, as doctors have also issued the notice on their strike. The other day we had a teacher strike. In fact, I don't think if it has come to conclusion, but teachers are still striking. Now, doctors have also issued their notice. Let me just read whatever they have said. It's happening. Doctors issue 2 weeks strike notice. Furthermore, they carried on by saying, doctors have issued a 2-week strike notice citing salary arrears on to health workers across over 40 counties. The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, has expressed frustration over the continued delays in payments, which they claim have created a financial crisis for doctors and other healthcare staff. Dr. David Atela, KMPDU Secretary General, said the doctors' grievances are rooted in the persistent failure by the county governments to honor their obligation to pay health workers on time. The union has accused county governments of failing to prioritize healthcare workers' welfare, with some counties owing salaries for up to 5 months. The lack of timely payments, coupled with already difficult working conditions, has severely demoralized medical staff, leading to burnout and mass resignation. The impending strike, if not averted, could cripple healthcare service nationwide, particularly in public hospitals, leaving millions of Kenyans without access to essential medical care. Despite numerous calls for dialogues and intervention, little has been done to address the concerns of medical practitioners. Effect September 5th. If the counties will not have paid doctors, we will withdraw our services. Let them not expect any services unless the salaries for July and August are paid, Dr. Taylor said. Medical interns were dipped. He adds it is unacceptable that doctors who are at the forefront of saving lives have to endure months without pay. This situation is unable and has left many of our members struggling to meet basic needs. We have been patient, but our patience has run out. That is what is happening, ladies and gentlemen. Now, allow me to remind you that this is not the first time doctors are issuing or are planning to strike in this country. Even when I flash back some years back, it is something which always happens in each and every presidential administration. Unless during Kibaki's time it was rare. But when Uhuru Kenyatta and William Ruto, it's now happening regularly. I want us to break this into our political discussion. The factors which is making doctors to strike and the effect on the strike. But before I carry on, ladies and gentlemen, may I take this golden chance to remind you that if you are watching me for the first time and you've never subscribed to this YouTube channel, I request you kindly do me a favor, take a 1 second and click that notification bell and subscribe to our YouTube channel. In that next time, when I upload to you such kind of a video, the video will automatically comes into your YouTube platform. And to the members, I want to appreciate you and thank you for your genuine support. Because if it was not your support, then this YouTube channel could have not reached or grown to where it is as at now. Let's proceed. Please consider to like this video as well. Now, when you see doctors are calling strike, it means that they have been annoyed with the government. And the government seems to take it as normal issues or occasion. That is why they have no time for doctors, as they still not having time for teachers. We saw the KOTU boss saying, bragging in social media platform, saying that let them strike. That is what the KOTU boss said. Rather than he should find time and create time for those who are in charge in teachers union or even teachers administration to find a solution on how the strike should be stopped. And that is why all the strike happening in our country, they happen because of our leaders bragging. They brag, they talk a lot, and they no longer have time to discuss what is really happening. And they rush into conclusion. They rush into conclusion and early judgment by saying they are striking because of their own interest. Now here comes another scenario. Doctors want to strike. We've known the experience and we've gone through that experience on doctors' strike. And we know the result. As they are striking, vulnerable Kenyans will no longer have treatment. Going to government hospital or even to public hospital will be rare, as it is now going to be turned to private hospital, which I conclude as saying more expensive as to some Kenyans. And some of the politicians, sons and daughters, will no longer have treatment in the country. They are going to be taken to other places like India, Vancouver, or even Netherlands to be treated. And that is what they want. Some people, like someone like Atuoli, talking and is capable of taking his sons or children outside the country for treatment, while other Kenyans take even 1 year, 2 years in order to be treated. Ndio wachangie pesa ama hivi na hivi, because all hands are not the same. Now, this is wrong and we are on a danger movement. If doctors can strike, teachers can strike, then we are doomed as a country. Why don't they just sit down and come up with a conclusion? I asked the government the other day that it is this is the best time President William Ruto's administration to reduce even the financial allocation to the governors, to the MPs, to the MCA, and even to any person in this country, whether it is government parastatal. There are some PSS taking a lot of money, having huge monthly salary. Why don't they reduce it and give this to doctors and teachers? It is simple and clear. Not all, but let them agree according to teachers' agreement and according to doctors' agreement. On doing that, Kenyans will be happy. Our sons and daughters will go back to school. Sons and daughters will be treated. And that is whereby we can now come to conclusion by saying there is free treatment being offered by the government. So the strike seems to be on, and let's wait how it's going to happen. That is what is happening, ladies and gentlemen. I rest my case at this point. I wish you all the best. Meanwhile, drop your opinion at the comment section below. Bye bye.